My Doctor, your health anytime, anywhere.
Hello, lovely people. Welcome to My Doctor podcast, where our aim is to educate the community about various public health issues. We want you to know, are they preventable? What are the risk factors? What can you do about it if you're already facing the issue? So yeah, please always come and watch the videos. They could be of great importance to you or your family or a friend or anyone really. So please make sure you tune in. So last week we had an episode about myths on UTIs, and we were with Dr. Lawrence Mugisha, who really did a great job. So if you haven't watched that episode, please go back and watch it. You will really learn a lot of facts about UTIs. And then for today, we have a very interesting topic, and that's non-communicable diseases. So we are going to talk about that. And according to WHO, 71% of the deaths in middle and low-income countries are caused by non-communicable diseases. And so they are a very great public health burden in our community, in Uganda and in Africa at large. And even to the patient, they are burden health-wise, even financially. Some of the drugs are expensive. When you're admitted because of complications, it's expensive. So we want you to know, before you reach there, can you prevent it? And if you have it, what can you do about it? What are the risk factors? So for today, we have a very special guest with us. His name is Dr. Nathan. I'm going to give him an opportunity to introduce himself. You're very welcome, Dr. Nathan.
Yeah, thank you very much. I'm Dr. Nathan Niwabaho, and I work with my doctor and other various clinics around. I've worked with very many communities with these non-communicable diseases, with other diseases. I have a chance that today we are going to discuss about the non-communicable diseases, which I have been practicing and which you have at least encountered with.
Okay, thank you very much, Doctor. So let's dig into the topic, non-communicable diseases. So could you maybe define them in an understandable language to everyone? Yeah.
Okay, non-communicable diseases, it is in a simple way a layman can understand. These are the conditions, the diseases that cannot be transmitted from one person to another directly. As simple as that. So for example, we have conditions like chronic kidney diseases. We have hypertension, heart diseases. You know, there's a difference between hypertension or high blood pressure and chronic heart diseases. We have diseases like Parkinsonism. Parkinsonism, when someone is shaking from nowhere, is shaking the hand or the whole body. It is sometimes we call it tremors. We have other conditions like cancer. Cancer cannot be transmitted from one person to another. We have other conditions like epilepsy. Epilepsy, it is common and it cannot be transmitted, whether in the blood or in the saliva. We have other conditions like osteoarthritis. It is very common in old age, but of current, we have started seeing them in other ages, middle age, from 45 and above. We used to have those conditions from 70s, 65, 70 and above, but of recent, now it has come down. We find people with these conditions, osteoarthritis. Osteoarthritis is different from osteoporosis, whereby the numerals of the bone density have reduced. It has lost its patterns to support the body. Those are all communicable diseases. Chronic kidney diseases, we have cataract, the opacity of the lens of those people. When you see them in the lens, you find when they have that white thing in the middle of the lens, the opacified lens is what we call it as a cataract. It is different from other things like glaucoma, but cataract basically is what we are talking about.
Yeah. So among all the many non-communicable diseases you've mentioned, which ones have you seen as the most common in your practice so far among Ugandans, probably?
Most Ugandans, they have a challenge with heart diseases. Heart diseases and chronic kidney diseases. Those two, they may be leading other non-communicable diseases. Of recent, we have seen cancer raising from a middle percentage. It is going to, at least when you see 100 patients, where you find that you have 5 you have encountered with, you're going to find them with cancer cells or cancer complications. Others have cervical cancer, breast cancer, cancer of the bones, and other tissues. So, but the leading, you'll find it to be having the heart complications and kidney complications. Yeah.
So what are some of the risk factors for these diseases?
Risk factors are tobacco use, smoking, alcohol, excessive consumption of alcohol, of which these alcohol are dangerous. There are those ones which are harmful, which are mixed spirits, and you find they are burning, and sometimes they kill some cells within the lungs, within the throat, and the stomach.
You've said those ones. Does that mean that there are some that are safe?
Yeah, you see, alcohol is not bad. I'm saying the harmful alcohol consumption. Some people take alcohol when they have not eaten, on empty stomach, and you find someone is taking alcohol from Monday to Sunday. And this is a person who is in a community, one is poor, but he cannot fail to take alcohol because he has friends to buy alcohol for that person, but cannot afford buying food for himself or herself. You find at the same point, this person have burnt the whole throat, the stomach alveolus, and the gut. So these patients, you find when they have got cancer of the throat and other parts. Smoking. Smoking, the dirty nicotine in it is very dangerous. And when it goes into the lungs, you find people getting cancer of the lungs. They get other things like accumulation of fluid within the lungs. And they get those complications.
What about...
Then for the case of hypertension, it's just all about diet and failing to have exercises, regular exercises and activities. In the town here, you find someone is going to work and leaves work late, day by day. In the weekend, the only time he has is to have a small booze around with friends. But if you ask this person how often he goes for exercises, he will tell you that I've been there for 1 month, for 2 months, 1 year. I've never been in a gym. I've never been in any activity that helps my body burn fats that I always take. And in the urban areas, you find we eat a lot of meat and packed foods. Meat, packed foods, and cold fridge things and all that. So you find you have a lot of deposits within our vessels that are not eliminated. After taking your fat food, then you take 2 glasses of juice, of course, cold. Then when you're going to sleep, you take again 2 cold cups of water. Now you allow these fats to solidify into the vessels, which is again a bad practice. But those ones in the villages, they have a problem of poor diet. We all have poor diet in town. We have that, but in villages, you find we have poor diet because we don't have foods to balance our diet regularly. Someone we find is digging, has a garden of fruits, but he cannot afford eating a fruit that is producing because he wants money. So he sends the fruits in the town, and you find for him is starving, hence starving the organs. And those organs that you find when they have got damaged, like kidneys. That's why in most cases, in village persons, you find them with chronic kidney diseases. While in town, you find them with hypertensive and heart conditions. Yeah.
So we have talked, let me take you back to the diet thing, yeah? So all that has showed that we have poor diet as the public. So what would be the ideal balanced diet for a person who wants to work on their diet out there?
Yeah, well, for example, when we talk about the balanced diet in town, you should have at least one red meat in a week. One red meat. A red meat, that is cow's meat, goat's meat, once in a week. You can take milk once or twice in a week, if you know that you can control it. But you should have a fruit on every meal. A fruit on every meal. Then we avoid fridged foods, drinks, and or whatever you want to eat should not be preserved in the fridge, because you will take it when it is too cold and it solidifies the food that you have put in. You remember, digestion takes place within 2 hours after food. Now, when you put in some this cold food, it helps you to solidify the food, and it is cold and it is stuck in one place. Now, the enzymes in the stomach will take long time to digest this food. The more it is there, then it is around 5. Again, you again add another food. You have not done exercise to help the body to catalyze and move this food outside. Now you add another drink. So we should have these foods balanced, at least red meat once a week. You have fruits every after meal. You should take enough water at room temperature. Then we should regularly have exercises. That is in life of town. Then when we come to the village life, people should have these fresh foods, especially increase on their refuge intake. Yeah, well, when you take refuge intake, you help the gut, the digestion, to take it out very fast. Secondly, avoiding starving. Someone goes to graze his cows, another one is digging, and like maybe 2 miles from home, and this person is going to go there, dig the whole day, then comes back in the evening and cook food and eat at around 8. The same food at 8 will take this person up to the other 5 or 6 in the evening of the other day. So you find they don't have time to eat because of too much or extreme poverty within the families and those villages. Yes, so they should exercise, have timely food, and help these kidneys to keep rehydrated. You see, with the challenge they have, you find someone moves in a village, they don't have access to good water. You find someone where he's digging is where there is a small well, or which that small well they have is where they bathe from, that's where they wash clothes from, and that is the water this person is going to take. Sometimes they wish to have this water, then you find you have taken it in a raw quantity and you have urinated it out, and the body have sweated and has taken all that out of the person. So dehydration causes kidney diseases. So that's why these people in the villages suffer a lot. You find someone is swelling the feet, swelling the face, the stomach, checking chronic kidney disease. Why? Poor diet, extreme poverty, and poor hydration of the bodies. Yeah.
So also still on the risk factors, does genetics play a certain part in some of these diseases?
Actually, genetics plays 100% in risk factors of this, because basically these are the non-communicable diseases basically originate from the families. It is a genetic thing coming, but it has these predisposing factors whereby the genetics, we cannot say that you are not going to get kidney disease or hypertension or what, but should be a certain age that you are getting these conditions. But when you find genetically you have it and you are having predisposing factors that attributes to its eruption very fast. That's why in the beginning I told you, we are seeing these chronic or these NCDs, the non-communicable diseases. We see them at early age. At around 40 years, someone is having chronic kidney disease. When you ask this person, will tell you, I used to live near water bodies. I was living around the lake and all that. Why? It's because that is the predisposing factor that helped the disease to manifest very fast. But genetics, it is the cause of the first thing. Yes.
So in simple terms, if I find out that I'm genetically predisposed, I should avoid the risk factors to at least lengthen.
You should avoid the risk factors. That's why you are saying, after knowing that my dad had diabetes, my mom had hypertension. Of course, in that, you keep in mind that at any time you are going to be diabetic. At any time you'll get hypertension. But how do you avoid these? You can avoid them to prolong the disease eruption within the body. Like how can say like tuberculosis. You find someone has TB. Everyone has a tuberculosis virus, bacteria within your body. Until your immunity has lowered, that's when the tuberculosis thing comes. So the same way, genetically, after knowing that you have a predisposed, you have a genetically background of these diseases, you have to look at how do I prevent them? How do I avoid the predisposing factors so that you can prolong its manifestation?
Okay. So for someone who has already acquired the non-communicable disease, can it be cured? Some of them curable, or you just need to learn how to live with it or just the complications?
Yeah. Well, it is something that I may say it can be traumatizing if I say no, and if I say yes, it will be again giving false belief, because it is a non-communicable disease. Those diseases, they are not curable, but they can be controlled. Yeah, someone will lie you if you say, I'm going to give you medicine to cure hypertension. I'm going to give you medicine to cure this chronic kidney disease. I'm going to give you medicine to cure epilepsy, cancers, and maybe Parkinsonism, autoimmune syndrome, whereby the body has started fighting its own body. Yeah, so those lupus conditions, they are very dangerous. If someone tells you, I'm going to give you medicine to cure it, to me, medically, I would say this person is just lying. But that is the hope we give to our patients, that you are going to be well, you are going to be okay. The only thing we do is to help this disease, this non-communicable disease, not to kill you very fast, to make sure that we have advised you on the prevention of predisposing factors. You know, when you have kidney disease, okay, for example, you have hypertension, you take drugs. You have pills you are taking for diabetes. Now, diabetes and hypertension, you are taking those drugs for maybe 10 to 15 years. They start now affecting other organs like liver. Now you get kidney disease. Now you start taking drugs for liver and kidney disease. Now in that concept, you have lived now for 15 years or 20. Now after 25 years, you are bedridden. You have to start dialysis to keep washing your kidneys all the time. We are now no longer targeting what brought the kidney disease. Now we are targeting the kidney disease because the other ones are no longer now a threat. Because we have known that the hypertension can be controlled, the heart diseases have not come, but now the kidney is failing. After failing one kidney, the failing the another kidney, we start having what? Dialysis. And you find we are washing the kidneys twice a week, so that we help this patient not to die in pain, not to die when his people, they are like, this is a burden to us. Medically, we have to keep that separately and know that this person is going to die, but not today.
Not today.
Yeah.
Yes. So there's something you mentioned that made me remember, there are these people who move around like in cars or like announcing, like I have medicine that will heal you, what herbal medicine in simple terms. Would you advise our dear patients to resort to herbal medicine? Because some people in the community out there, when you explain to them that this could not be curable but we can control, they try to find something else. They try to find they resort to something else. So what advice would you give our patients out there who are trying to switch to herbal?
Yeah, herbalists are good. They are good. They are our people. We know them. They have license from Ministry of Health. They have license with National Drug Authority. And what they do, they use the fruits, they use the herbs, they use the foods that you failed to take when you were able to take them. So you'll find you have used, for example, grapes. They have got those grapes, they have mixed watermelon, they have mixed maybe oranges, they have mixed other trees. Now, they mix them for you because you have failed to take them in time. After knowing that you have a predisposing factor, after knowing that you have a genetic background of this condition, you failed to take these foods. Now, these herbalists, what they do, they just pick one thing from you because you are already frustrated. You have tried the medicine in hospital, you have failing. Now you are like, what should I do? Let me go to herbalists. When you go to herbalists, they know, oh, you have a kidney disease. Kidney disease, I know grapes, I know this fruit, I know this tree. They just mix one thing that helps the fats, burn the fats, or make you urinate more frequently. There are drugs, the more you take water, the more you urinate. I think you know it. Now, they will tell you take this 6 times a day. Because you are frustrated, you will take this medicine six times a day. And in big quantity, like 1 liter at a time. The more time you go for urination, the more helping you are helping the kidneys to also get relieved. So this person gets to know that, oh, this drug is helping me. I no longer have swollen feet because there is no accumulation of fluids within the feet because of your urination frequently. So I don't advise them, but of course, if that is what can give them the relief, they can go to them. But the issue is, the logic behind is, the more time they use and the faith they build against it. And you'll not see any person coming there to testify that I took 2 jerrycans of herbal and I'm free now. You'll not see any. They will end up dying. But of course, they will die knowing that, the other doctor tried. But I used it to urinate only once a day, but now I've been urinating 3 times or 4 times a day, just because of the too much fluid is loading the body. But I don't think the herbal medicine at an advanced age of the disease, it can take the disease away.
So we have come to the end of the episode. So I'd like to give you an opportunity to give any remarks to the public about non-communicable diseases, anything we could have left out in the conversation, or anything you feel like people should really know about these diseases.
When we are talking about this, many people will be very much interested in knowing what we have discussed. But again, they will know, some other will say, what about if I have these drugs and the herbal medicine and it have cured me? But of course, we have discussed it, I think, to the length. Then another thing that I can discuss is about self-medication. Self-medication of any kind. You find someone is telling you, I have the medicine curing diabetes, it takes high blood pressure, it kills kidney disease, it takes this. Almost like the way we have listed the non-communicable diseases. And someone has a small bottle which has the medicine that cures all that. Now, what you should put in your mind is, first ask yourself, if I am not diabetic and I take this drug that takes away diabetes, what will happen? You understand? That's why I want to bring it clear to that line. That you should first understand someone telling you, I have this drug, it helps you gain back your manhood. You remember, I think I have not talked about it, but the most complications, especially in diabetic patients, they lose their manhood. You find someone has weakness in manhood and does not function. You find women are just going away and other men are just stranded there. They fear going back home because they fear going to the bed. They know they are going to be embarrassed by their partners. But you will ask yourself, if you have that, how about me who doesn't have, but I have a different condition? What would I gain out of there? So sometimes we should not, I tell the public, they should not only trust this combination of very many things treating one thing. They should be in position to know that whatever they are doing, if it is a monotherapy treating diabetes, then it is okay. But these multiple therapies, whereby it treats very many things, they should be conscious and they should question themselves why and how and what will I gain from this. Yes, that's what I should do, question the public. Then self-medication from pharmacies, from our hospitals and whatever. We have our telephones. We have, when you go to a hospital, you find a doctor, you have a telephone number, you have a WhatsApp number, you have other means of communication like those channels. At least when you are sick and you are not comfortable with what you are doing, you can contact the health factor, the health personnel. Before going to buy Cipro, you buy Ampicrox, you buy this. Because you have swollen legs, you start buying those Lasix, the furosemides and all, because you want to release this. Yet you are complicating the disease. I advise the public to always go for checkup before starting any medication. You have headache, you don't know whether the liver enzymes are high or low, which are causing the headache. Go for checkup. Let the health personnel start advising you on how to do this. Yes, self-medication is very dangerous, and it is one of the predisposing factors of many conditions that we face in the community of Uganda.
Okay, thank you so much. Lastly, okay, you said something about the manhood thing, and I know that's something that takes a toll on the men's mental health when they get such complications. So if someone comes to the hospital, because I think some of them tend to keep quiet about it, not to get embarrassed, some. So if they come to the hospital, are they redeemable? Is there something we can do for them, like medications, to like bring that back?
Yeah, well, there are drugs, but these people who come to the hospital and they feel, this stigma is very dangerous. We tried to eliminate stigma from HIV patients and now they are free. They come to the hospital and tell you, I want condom. They went to the hospital and say, I want to check for HIV. And after telling them you are HIV positive, they say, oh, doctor, what should I do? I'm HIV positive. What can I do now? You see, that stigma that was there, it is no longer there in the community about HIV. I advise everyone to also have this. In non-communicable diseases, side effects that they are bringing, or the effects, the permanent effects, they should not be worried, they should not be stigmatized, they should not have these issues of like, how will the community look at me? They should be free with medical personnel. Yes, and talk to us, tell us what you are feeling, because even if you don't tell us, I will automatically know after asking you, how many years have you been with diabetes? It's telling me 6 years. Automatically, I will not ask whether the woman is there, where your wife is. I will know exactly what is in the bed. So you should always be in position to tell me that, oh, but I have even this issue. Then, of course, I have already known it, then I should bring it and help you. The drugs are there, but basically, the lifestyle. When we control the diabetes, these hormones will again regenerate. There is no need of using those penagulas, the Viaguras, those energy boosting, because the more you use them, they affect the heart. They pump too much blood in the heart and you get other diseases of the heart, like coronary heart diseases and cardiomegalies and all the rest. So they should not be fearing to talk to us. They should trust the doctor they have found in the room to tell them all their problems.
Problems.
Yeah.
Yes, okay. Thank you very much, Dr. Nathan. I'm sure the public has learned a lot about non-communicable diseases. I'm sure people can now prevent them and prevent the risk factors and everything. To our lovely viewers, I hope you have learned a lot. I personally have learned a lot. And I hope you are going to have a balanced diet after watching this video. Exercise, avoid smoking, reduce on your alcohol intake. And if you're genetically predisposed, really work on reducing on the risk factors. So I hope you really learned a lot. Thank you for staying with us. We're going to be having more of these episodes occasionally. So please always search for the My Doctor podcast and you'll be finding our various episodes there. Yes, my name is Mwesigwa Joy. Stay with us.
My Doctor, your health anytime, anywhere.